Hello and welcome to today's press briefing. My name is Jen Rumbalski. I'm the director of the La Crosse County Health Department, and I'm joined today by Dr. Kowalski from Gunderson Health System and Dr. Fitzgerald from Mayo Clinic Health System. And we have an important message to share with you today. I'd like to first begin by sharing an overview of some of our local data from this past week. Our case rate has increased from last week to 35.5, that is per 100,000 people per day. This is trending in the wrong direction. We would like to see this going the other direction, and our current increase from last week is 23% higher. Our new hospitalization rate has held steady at 6.1, and also that is per 100,000 people per day. 16.3% of our tests completed this past week have been positive. And I do want to note here that we don't have a backlog any longer in negatives that are coming in directly through our electronic disease surveillance system. So this means to you that this 16.3% of tests being positive is a true positive rate. Our public health team is strained and feeling the stress from continuing to have to contact large numbers of cases and contacts. Our goal for reaching cases is 48 hours. Our health department team has had so many cases that we've only been able to reach 67.7% in this past week's timeframe. Only 59.1% of case contacts have been reached within 48 hours. So my message about that is that if you receive a call from someone at the La Crosse County Health Department, we ask you to answer the phone and talk to us. Call us back if we missed you and let us help you. If you test positive, call your contacts to let them know that they may have been exposed. You can send them to our website, lacrossecounty.org/COVID-19 for more information about what you need to provide. The average age of cases has risen from 23.7 years of age to 40.6 years of age, reflecting more cases in varying age groups as well. So next, I want to share a little bit of context from the state of Wisconsin as a whole, because it certainly does play into the overall picture as we look at our local data as well. So Wisconsin is in a crisis right now, and it's really up to each of us to take action in our own lives to stop the spread of COVID-19. As of Monday, Wisconsin surpassed 200,000 cases. It took 7.5 months to get to 100,000 cases and only 36 days to get to 200,000. Tuesday's numbers for confirmed cases and deaths from COVID-19 are both the highest that we have seen throughout the entire pandemic so far. Wisconsin's daily numbers keep getting worse, and in 2 months, the 7-day average has increased over 400%. Our 7-day average of daily deaths at the state level is 31, the highest ever. Wisconsin is seeing a significant surge throughout the whole state. Many hospitals around the state are also experiencing overwhelm. Dr. Kowalski and Dr. Fitzgerald will address our local healthcare capacity, but some hospitals across the state have critical staffing shortages, largely due to staff members experiencing infection or exposure to the virus. I'll turn it over now to Dr. Kowalski to share more.
Thank you, Jen. Dr. Fitzgerald and I have participated in a number of these media conferences over the last number of months, and we often bring up some very similar points. We talk about masking up. We talk about physical distancing. We talk about limiting interactions and washing one's hands. And the reason we do that is because of just how critically important those are in changing the trajectory of the region. These are scientifically proven. The science is sound. This is what works, and they are absolute best defense in preventing the spread of COVID-19. So today we really bring a similar message. I would double down on all of those, but we have an additional ask to bring to you. We're seeing cases climb in our region, and importantly, as Jen pointed out, we're seeing the demographics shift to an older population where the morbidity of this disease is more likely to result in hospitalizations. And that's both here and that's in the counties surrounding La Crosse County. I want to be clear, we are not in a dire crisis in terms of our local healthcare capacity. Right now, both Gunderson and Mayo continue to have capacity to care for both our COVID patients and our non-COVID patients, to provide the clinical and hospital care for all of those types of illnesses and procedures that are necessary and important. We remain open, and we remain a very safe place to be. And it continues to be important that if medical care is needed, that medical care is sought and rendered, because there are implications if it is not. However, as we are thoughtfully planning on increasing our capacities to care for more COVID patients, we are really feeling the strain of hospital capacity, and we are seeing increases in our COVID units. We are seeing increases in the strain on our great caregivers, on our incredible staffs that provide care to these patients. These are our friends. These are our neighbors. These are people who are so incredibly committed to caring for you through all sorts of illnesses, and the strain is taking a toll in terms of their ability to do so and to remain resilient and strong. These are people. They're amazing people, but they are people. And as we continue on through this pandemic, the reality of caregiver burnout is real, and it continues to be a struggle for even the most professional folks. I'm working in the hospital this week, and I can't tell you how proud I have been of the professionalism and commitment I have seen. And yet I know the strain that many of our teams are under. So with that, I'm going to turn it over to Dr. Fitzgerald and have him share some comments as well.
Thank you, Dr. Kowalski. I'll just echo that. I've been around some of our hospital facilities. I think we're still able to care for all the patients we need to care for. However, we're seeing more employees in the healthcare setting that have to quarantine due to exposures, and that really causes issues with staffing. Very similar to what we saw in the skilled nursing facilities a few weeks back. So what we do in our community really does affect our ability to render healthcare, and we want to affect that as best we can. So with that in mind, our ask today is for the community to help us. We need people in the community to really change behaviors such that we can do things to minimize the spread of COVID, and especially with the age demographic, with the age groups and being a little bit older and with more background medical issues, limit the spread such that we don't have as many hospital admissions. We want to do this so we reduce the strain on our regional healthcare systems and really decrease the stress level of those incredible people working on the front lines of COVID and really the other health, inpatient healthcare issues that we have. I would ask everyone in the community to promote with your family, friends, and neighbors the basics of wearing a mask, the basics of avoiding large groups and gatherings, to really hardwire the processes of washing your hands regularly, avoid touching your face, use hand sanitizer when you don't have a sink in front of you to wash your hands. This is the way to get to, again, flatten the curve again, help us get to the end of this pandemic without having hospitalized type illness, really have people ill to the point of death. And that's what we're facing right now in our community. It has shifted from, by and large, being college students a few weeks back, and then skilled nursing facilities and assisted livings more recently, to being in the community with people with healthcare issues that are having to go to the hospital because they are ill with COVID. That is what we've seen the last few weeks. It is a very serious issue. The other thing I'd like to really put a plug in for is to make sure that everyone would get a flu shot this year. We want to encourage as many flu shots as possible. This will help us with the overall illness burden in the community. It's going to be confusing for some of us in healthcare to try to decide what's influenza and what's COVID. And more importantly, if we can decrease hospitalizations from influenza, it really help us with the burden of what we have to take care of in our inpatient practices. So with that, I'll turn it back over to Jen.
Yeah, thank you both, Dr. Kowalski and Dr. Fitzgerald. Appreciate those comments. Very important for all of us to be aware of. Next, I just want to take a few moments to remind you and all of us of what we can do to help prevent the spread. First and foremost, stay home. If you leave your home, we want you to do it for the essentials, your job, unless you can work from home, groceries, medical appointments, the pharmacy, and really nothing else. We would ask you to cancel travel and social gatherings. Do not interact with people that you don't live with. We all want to support local businesses, but the way we should be doing it right now is by ordering takeout for a meal or picking up items curbside. Avoid businesses or locations that are not following recommendations on masks, physical distancing, and capacity limits. Make an informed choice for your family about Halloween. Begin to think about safe alternatives to upcoming traditional holiday gatherings. I do point you to resources that are available on the lacrossecounty.org/COVID-19 website relating to safe holiday gatherings. Wear a mask is my next message. Your mask protects me and my mask protects you. That's how it works. Together, we protect each other, our families, and the rest of our citizens in Wisconsin. Practice physical distancing. Stay 6 feet apart. Wash your hands frequently and avoid touching your face. Use hand sanitizer if a sink is not available. Get tested and know your status. Call your healthcare provider or visit a community testing site. At community testing sites, anyone can be tested, whether or not you have symptoms. You can find a site by visiting lacrossecounty.org/COVID-19 and clicking on testing information. That is the best location for those community testing sites and the information about when they are and where they are. If you have symptoms or you are a contact of a positive case, you need to quarantine while you wait for your test results. Get your flu shot. We talked about this already, but the flu shot does not protect against COVID-19. Recognize it protects you from flu. We keep the number of people needing hospitalizations down due to flu if we are seeking to get the flu shot. And that helps preserve our hospital capacity. And I also want to point out to be a leader in your circle. So talk to your friends and family about the importance of these safety precautions. And I really want you to have the courage to challenge misinformation, share helpful resources, and have these conversations with your family members. For businesses, public venues, or public buildings and venues, a reminder that we can continue to recommend minimizing mass gatherings in businesses, public buildings and venues. Capacity needs to be limited to 25% or 50 people indoors, 100 outdoors, whichever is less. Masks and physical distancing should be required. Venues should consider canceling or rescheduling any large gatherings planned for the next 14 days. We need to take these actions to make sure that we can help our community get better. We want to help keep our schools and businesses open by taking these actions. I recognize and know that we're all tired, and when we're tired, we really want to return to normal. We just can't do that right now. We have to remember that you can have COVID-19, you can even spread COVID-19 without knowing it, which means that you could be the reason that your friends or extended family members or the server at a restaurant or really anyone that you interact with might get sick or even hospitalized. You don't want to do that to your community or to yourself or loved ones. So my last message is, together we can stop the spread. So that's what we have to share today, and we'll now take questions from our media partners.
Hello, thanks for having this. This is Marcus from News 19. I know you said our hospitals aren't close to reaching capacity, but I want to know how close they are and how talking about that and what can you guys say differently that makes people realize that this could get worse.
Maybe I'll take that and I'll let Dr. Fitzgerald jump in. And I might actually change the phrasing a little bit. We have capacity, but we are concerned about reaching capacity in the coming weeks if these deeply concerning trends in terms of illness rates, illness demographics continue. And so this is a level of strain and a level of concern from a hospital perspective, from a infectious disease epidemiology perspective that I have not had for the 6 to 8 months of this pandemic. So it is a new level of concern and strain that I bring forth today. Are we able to meet current healthcare needs today, tomorrow? Yes, we can. But I am deeply concerned about the trajectory when I look at where we're at as a region, and when I look at where we're at as a state. There are many other systems in many other regions that have hit crisis status, and we're headed that direction. So this is really a call out that the actions that we take today, the decisions we make about what we do and how we do it in the next 2 weeks are really going to determine where we are at in a healthcare system standpoint in the coming weeks.
completely agree with that. I think so our facilities are still able to care for patients, and we still have capacity to care for more patients in our facilities. Really, one of the big things we worry about is the staff who need to be there to take care of these patients. There's more illness in the community, there's more of our really dedicated staff that gets exposed to that illness, both at home and at work. And some of those folks have to go into quarantine. Some of those folks end up testing positive for COVID. The less overall illness there is in the community, the less illness that's to the point of hospitalization, the less you put that staff at risk. So what we do in the community, our behaviors affects our healthcare staff. You're putting those staff at risk. I'm married to an ER nurse. She sees people who are sick all day long. So really, there's no excuse to be in large gatherings right now where you could spread this virus around, because you really are putting healthcare providers at risk.
Yeah, this is Jordan Fremstead from WKBT. This question is for Jen and Dr. Fitzgerald and Dr. Kowalski. It's kind of a two-part here. So looking at yesterday's rally, and I was there, and the crowd, it was huge. So my first question is, what's the concern in the days after that rally? And then in speaking with, rally supporters and the campaign itself, they don't believe that COVID-19 is as bad as you guys say. And the numbers, they think that, 90% of people are fine with this disease, and they don't necessarily understand the impact that something like this can make. So how do you communicate to those people who don't trust healthcare? They trust what the president is saying on a stage.
So
I think it's numbers. Go ahead, Jen.
Okay. I'll just start by saying, in regards to that gathering, it's not unlike other large gatherings, and we've seen spread and cases and contacts and impact from other large gatherings. And, it's not likely that we'll know exactly how many cases or contacts might have happened relating to that or any other large gathering. Usually it's minimally 5 days to up to 14 days later that we actually know what the true impact might be, if we ever truly know the full impact. We have to be able to link things back, and sometimes that's challenging. So my main message is that any large gathering like that is a great way for COVID-19 to spread. It's just that's how the virus spreads. So I think we need to be really careful about any gatherings like that. And in regards to your comment, Jordan, about the national message, we do continue to hear that that it's not, that we're turning the corner, that it's not as bad as it seems. I would say to that, we look at our local data, we look at our state data. That is not the message that we get from the data. So I would prefer to be guided by what the data is telling us, and that's how we will continue to process that information and recommendations relating to that information for our community, because that is the best way for us to properly advise our residents.
Yeah, I agree with that. And again, I would respond to those folks that would say that, whatever percentage of people could have the virus and not get ill, at least ill to the point of hospitalization. Understand that there are age differentials with that. So if you look at the data, very young people do have a very low rate of hospitalization, not zero, but a pretty low rate. When the surge was within our college students, again, those students, that age group has a very low incidence of illness to the point of hospitalization. But as the age demographics increase, as you get into the 30s, 40s, 50s, 60s, and beyond, the number of people who get ill to the point of hospitalization raises. So for those people who say 90% of the people won't get sick, if you're in your 40s and 50s, it may be that, up to 5% of those people will get sick enough to be hospitalized. As we saw in the nursing homes, up to 10% of the people in those settings were sick enough either to be ill to the point of death or have to be hospitalized. So it's a numbers game. Do the numbers. If we get up to a few thousand people with the virus and 10% of them are going to get ill to the point of hospitalization, our hospitals are going to get overrun.
Great point. Viruses don't care why we get together. They care how we get together and how we interact. And so no matter what forum one's at, it is a risk. That would be number one. Number two, we're at the point, this is not a drill. We are increasingly opening COVID units. We are seeing healthcare staffing issues that are coming to into play, and really increasing our concerns that in the coming weeks, if we don't change course, there will be issues. There will be issues in terms of our abilities to really give the kind of care we want to give the way we want to give it. So again, this is the science, and the data is pretty clear. And if you look at the state of Wisconsin right now, we are not in a good place. And in La Crosse County, we're a couple weeks behind where some other places have been. But I'm deeply concerned based upon the ages of who's getting sick, the rates of spread in the community, and some of the events that are happening in the community and the ongoing gathering, that we're headed in the wrong direction. We really need to change that.
If things change as you're talking about, how do you shift the hospital staff to adequately take care of patients?
I think you prioritize things. Again, right now we're able to take care of all of our non-COVID issues, and really, some of those elective surgical issues, some of those things that I think are important to keep track of for the overall health of the community. But as we get more and more inpatients due to COVID, some of those things have to be offloaded. So if you get to the point where your finite number of hospital beds are taken up by COVID patients, some of those things we would otherwise have cared for, we won't be able to care for. And I think, again, as we saw the crisis in New York City, number one, we were new to this, and they really didn't have some of the, protective equipment that they needed. But really what happened is their facilities were overrun to the point where they didn't have the staff or the facilities to take care of those folks. And that's what we worry about. And again, we need to care for heart disease. We need to care for diabetes. We need to care for other medical issues. And if we get too overwhelmed with COVID, those things fall through the cracks.
I cannot agree more with what Dr. Fitzgerald said. And let me just augment that with a little more data. We know recently published data that excess mortality in the United States from March 1st to August was up 20% compared to a typical year. And so that is not a small number, that's a significant number. But even deeper into the data, 2/3 of those deaths were COVID-related deaths, but 1/3 of those deaths were not COVID. And so what that really does is it paints the picture. It is not all COVID and all non-COVID. We need to be able to have healthcare as a critical infrastructure for this region to be able to care for all types of illness, heart attacks, strokes, other types of infections, and COVID. And when we get so consumed with these really ill COVID patients, it really puts other care at risk. We're not there today at Gunderson and La Crosse, and I am so thankful for that. But I am concerned if we don't change behaviors, we will be there in some period of time.
On a similar wavelength to Jordan's question, so I'm going to guess the answer might be the same. Any response to President Trump saying come November 4th, COVID will go away, implying after Election Day this ends?
I'll just go back to saying that, again, the data does not support that. It just doesn't support it. There's no other way to speak to that comment or that statement that I've heard in the past. That is not a reality according to the data that we have.
Hi, this is Hope with Wisconsin Public Radio. I'm just curious, when you say that a lot of this transmission is happening at social gatherings, are those social gatherings happening at private residences, or are they happening at businesses as well? And I'm also curious if you can speak to transmission at bars in particular.
Yeah, so Hope, your question, I can only answer part of it. So what I can tell you is that we have seen that connection to social gatherings. I know that it definitely includes gatherings at private residences, but it also includes going to weddings at venues, funerals, those kinds of gatherings. So it's not always just in private residences. As far as connections to businesses, it's really more the fact that those employees at those businesses have potentially been at one of those large gatherings that are more social in nature and are either a case or a contact to a case and have to be in isolation or quarantine. That is what is impacting our business community and others in our community right now.
We have a question from Emily at the La Crosse Tribune. It's 2 parts. If the case numbers continue to climb and remain high come Thanksgiving and Christmas, would you recommend canceling all non-household member celebrations, especially given many families include grandparents or great-grandparents in the gatherings? And are you expecting cases to increase during the holiday season?
Yeah, I'll come back to a point that I made earlier, which is, whether it's Halloween or Thanksgiving or Christmas, we have to remember that gatherings, especially with anyone from outside your household, are a way that COVID spreads. So we want you to be informed. We want you to make good informed decisions about what is best for your family in gatherings. Look at our website under resources for information that you can use to make those good decisions. And then my next statement is to really be courageous and have those conversations with your family members now, because none of us want to be part of spreading disease, spreading COVID to our family members in order to get together with them and try to have a normal Thanksgiving and Christmas. So it really is about being aware of who and how your setting is when you're thinking about those kinds of gatherings, and knowing that those are the places where COVID is spreading right now. So we want you to make informed decisions for you and your family so that you do not find yourself in a situation that no one wants to be in, which is having been part of spreading or an event that has spread COVID to family members or friends.
Yeah, I would underscore one of Dr. Kowalski's previous comments. The virus doesn't care. The virus doesn't care if you're in a group of a dozen to 20 people that are all your family members, or if you're in a group of a dozen to 20 people who are strangers. It's going to spread if you're around people and you're not wearing masks and you're not protected. So again, I would advise everyone to at least prepare to cancel holiday holiday plans based on what the risk is at that point. I think that's the reality of where we are.
And I will just follow that with, again, I know we're all tired. I know that we want COVID to truly go away, but the way that we get it to go away until we have a vaccine that can provide immunity to individuals is to follow these guidelines. This is the way that we do it. It's the only set of tools we have. And, hopefully next year around holiday season, we don't have to have this conversation. So, I know it seems like a long ways away to think about next year, but we really have to take these precautions seriously.
I'm going to just add a couple comments. I remember saying in March that there was no place in the world I'd rather be than in the Cooley country, with the healthcare capacity that we have, with the community that we have, their willingness and ability to come together in a time of need, to have grit to get through a hard time. And I think this is a time where really looking for that community to come together, really looking for us to pull together. The more we do, the closer that light at the end of the tunnel gets. And it is a tunnel, not a cave, but we got to do it together.
Do we have any other questions from our media today? I don't see any.
Well, on behalf of Mayo, Gunderson, La Crosse County Health Department, I thank you for being with us today on this briefing, to our media partners for helping us get this important message out. And I, again, just want to reiterate and encourage you to take the precautions seriously. This will help us get through. And I hope you have a safe and healthy rest of your week. Thank you so much for being with us today.